John, Stacy, thank you so much for joining us today, and thank you for contributing to the Pathstone Clinic in Grimsby. The mass vaccination clinic at the Niagara Falls Convention Center may be closed, but there are vaccination clinics still on the go. Diane Legros and Kim Friesen from the region join us, though they're both managers of the mass vaccination clinics. Diane, we'll begin with you. The strategy is changing once again to focus on more locations in different areas.
Yes, that's right. We are just closing our clinic at the Scotia Centre, Niagara Falls Convention Centre in Niagara Falls, where we were so grateful to see 53,000 people, just over 53,000 came to get their booster vaccines while we were at that location from January 3rd until February 5th. And now we are moving back out into smaller clinics across the region, trying to visit all the areas, all the municipalities in the region to really bring the vaccine as close to people as possible to increase the convenience and really hopefully encourage people to come visit us and be vaccinated.
How was the response to those clinics? I know you said 53,000. Is that about what the region was expecting?
You know, to be honest, we're grateful for everybody that came out. We definitely had the capacity to do more. However, given maybe the winter, the circumstances, so many people were isolating, and it didn't turn out to be as many as we could have done. But we're certainly grateful for the participation and of the Niagara Falls staff there, and all the people that put together that clinic, the staff that were involved, the volunteers that were involved. Every vaccine that was provided there was a success.
Kim, when we look at this new strategy, how does the Niagara region staff all these clinics in different areas?
Well, when we were at the Scotia Centre, we had a lot of help from the other programs in public health. We redeployed staff from many of the other programs. But once we left the Scotia Centre, those staff went back to their programs, and now we're just working with our small mass immunization team. But we work that team 7 days a week, and our clinics, our shifts are actually 11-hour days so that we can run our clinics well into the evening. And we're also looking at school-based clinics as well on the weekends. And we want to do those school-based clinics on the weekends so that parents can accompany their children to those clinics and support their kids when they get their vaccines.
And that's really key, isn't it, Kim, that we do need to get the young people vaccinated?
We absolutely do. We want to be able to do that so that they can stay in school and they can actually do their extracurricular activities safely and continue to do those extracurricular, because we know that's so important to their mental health.
Diane, it's a real blitz this week with, I think, 5 different communities.
Yes, so we are at the Penn Center this entire week. We are also visiting St. Elizabeth School in Wainfleet on February 12th. Port Colborne, we're going to McKay Public School. We are also at the Port Colborne Visitor Center from February 9th to the 11th as well. And then if you please go to our Niagara Region Public Health website to get a full clinic listing every week. And we're working hard with our communications team to make sure that that information is spread out across the region. Because we do know accessibility is an issue, and we want to make sure that these clinics are convenient for everybody to come to.
Kim, the vaccinations are booster shots for those 18 and over, am I correct? And also first and second shots for the young people.
First and second for everybody at our clinics, and the clinics are also walk-in. So if anybody doesn't have an appointment, don't worry about that. Just come on in. We'll be happy to see you.